Hello, I'm Dr. Emily Carter, and today we're going to talk about something deeply personal that many people experience after 40 but rarely discuss openly. You look in the mirror and notice your hair isn't as thick as it used to be. The part looks wider. The hairline seems to be slowly moving back. You see more strands in the shower drain or on your pillow. Maybe your ponytail feels thinner. Maybe your barber mentions something subtle. Hair loss after 40 can feel unsettling, even alarming. But before you panic, it's important to understand something very important. Your hair is often a reflection of what's happening inside your body. Hair is not just cosmetic, it is biologically active tissue. Each strand grows from a follicle that depends on blood supply, nutrients, hormones, and cellular energy. After 40, the body begins to shift in ways that can directly influence the hair growth cycle. Understanding those shifts can help you respond early instead of feeling helpless. Let's start with the basics. Hair grows in cycles. There is a growth phase, a transitional phase, and a resting phase. At any given time, most of your hair should be in the growth phase. As we age, that growth phase gradually shortens. The resting phase may lengthen. This means fewer hairs are actively growing and more are shedding. The overall density slowly decreases. This change can be subtle at first, but becomes noticeable over time. Hormones play one of the biggest roles. In men, gradual changes in testosterone and its derivative, dihydrotestosterone, can shrink hair follicles over time. This process is often genetic and tends to affect the hairline and crown. In women, estrogen levels begin fluctuating in the 40s, especially during perimenopause. Estrogen helps support hair growth, so when levels decline, hair may thin diffusely across the scalp. But hormones are not the only factor. After 40, many people experience increased stress. Chronic stress elevates cortisol levels. High cortisol can push hair follicles prematurely into the resting phase, leading to increased shedding several months later. This type of shedding often surprises people because the trigger happened months earlier. Thyroid function is another critical factor. The thyroid regulates metabolism at the cellular level. Even mild thyroid imbalance can disrupt the hair cycle. You may also notice fatigue, dry skin, or temperature sensitivity. Hair thinning related to thyroid issues is often diffuse rather than patchy. Nutrition becomes increasingly important with age. Hair follicles are among the most metabolically active structures in the body. They require adequate protein, iron, zinc, vitamin D, and B vitamins. After 40, digestive efficiency may decline slightly, and nutrient absorption can become less optimal. Iron deficiency, even without full anemia, can contribute to shedding. Low vitamin D levels are also commonly associated with hair thinning. Blood circulation matters more than people realize. Each follicle depends on a tiny blood vessel delivering oxygen and nutrients. Conditions like high blood pressure, insulin resistance, or smoking can impair microcirculation. When blood flow decreases, follicles receive fewer resources and growth slows. Insulin resistance deserves special attention. After 40, the body's ability to regulate blood sugar often becomes less efficient. Elevated insulin levels can indirectly influence hormones that affect hair growth. This metabolic shift may not cause immediate symptoms, but can gradually contribute to thinning. Sleep quality also affects hair. During deep sleep, growth hormone is released, supporting tissue repair and regeneration. Chronic sleep deprivation disrupts this balance and may slow follicle recovery. Over time, this can influence density and thickness. Another factor is inflammation. Low-grade chronic inflammation becomes more common with age. It can affect the scalp environment and hair follicle health. You might not see visible redness or irritation, but internal inflammatory signals can alter growth cycles. Let's also talk about sudden shedding. Sometimes people notice dramatic hair loss after illness, surgery, rapid weight loss, or emotional trauma. This is often temporary and related to stress on the body. The follicles shift into a resting phase and shed a few months later. While alarming, this type of hair loss can stabilize once the body recovers. Genetics certainly influence patterns of hair loss, but genes are not destiny. Lifestyle, nutrition, stress management, and medical monitoring all play important roles in how quickly or severely thinning progresses. Now, what can you actually do? First, do not ignore gradual thinning. Early action is more effective than waiting. If you notice consistent shedding or visible scalp changes, consider getting blood work to evaluate thyroid function, iron levels, vitamin D, and overall metabolic markers. Second, prioritize protein intake. Hair is primarily made of keratin, a protein structure. Many adults unintentionally reduce protein consumption as they age. Adequate intake supports follicle strength and growth. Third, strength training helps regulate hormones and improve circulation. Resistance exercise supports testosterone balance in men and overall metabolic health in both men and women. Improved circulation supports scalp health. Manage stress intentionally. Chronic stress silently affects many body systems, including hair. Techniques like regular exercise, deep breathing, mindfulness, or even structured relaxation can lower cortisol levels over time. Scalp health matters too. Gentle scalp massage may support circulation. Avoid harsh chemical treatments or excessive heat styling, which can weaken hair shafts and create the illusion of more thinning. Be cautious with extreme diets. Rapid calorie restriction can shock the body and push follicles into shedding. Sustainable nutrition supports long-term growth better than aggressive dieting. If hormonal changes are significant, medical consultation may help. In some cases, targeted treatments can slow progression. Early intervention usually leads to better outcomes. It's important to remember that some thinning after 40 is common. The goal is not perfection, but preservation and support. Many people maintain healthy, full hair well into later decades by addressing internal factors early. Emotionally, hair loss can impact confidence. It is normal to feel concerned, but fear often leads to impulsive decisions, like buying expensive products that promise unrealistic results. Focus first on internal health. Hair reflects systemic balance. Pay attention to patterns. Is thinning gradual or sudden? Is it localized or diffuse? Are there accompanying symptoms like fatigue, weight changes, or temperature shifts? These clues help identify underlying causes. Your body rarely changes without reason. Hair loss is not random. It is often a signal that something internally has shifted, whether hormones, stress, nutrients, or metabolism. After 40, proactive health becomes more important than reactive health. Instead of waiting for severe thinning, respond early. Support your body consistently. Aging does not mean inevitable hair loss. It means adaptation. With the right information and habits, you can slow progression and maintain healthier growth for longer. Listen to your body. Nourish it, strengthen it, rest it, manage stress. Monitor key health markers. These steps do not just support hair, they support overall vitality. Hair is visible. It often alerts us to internal imbalances before other symptoms appear. Treat it as information, not just appearance. If you've noticed changes, do not panic. Take it as motivation to evaluate your health more deeply. Small adjustments now can prevent more dramatic changes later. Your 40s can be a decade of strength, awareness, and control. And that includes protecting your hair. Understand the signals. Act early. Support your body from within. And remember, healthy hair begins with a healthy system.